In June 2021, Attorney General Letitia James announced that New York would receive nearly $230 million in settlement funds from opioid makers. Now plans are being made for how those funds will be used to treat and prevent addiction across the state. Commissioner Chinazo Cunningham from New York's Office of Addiction Services and Supports will help manage the distribution of those funds through the Opioid Settlement Fund Advisory Board. To learn more about the task that lies ahead, David Lombardo of the Capitol Press Room spoke with OASIS Commissioner Cunningham. Take a look.
Well, welcome back to the show, Commissioner. I really appreciate you making the time for us again.
Great. Happy to be back.
So prior to the Opioid Settlement Fund Advisory Board convening its first meeting in June, state lawmakers and Governor Kathy Hochul identified more than $200 million in settlement funds that they wanted to spend in this fiscal year. What sort of input will the board have in figuring out how that money actually gets spent?
The advisory board definitely will have input. We're looking for them to provide recommendations, and we will consider their recommendations on how to spend, the money that exists.
The board's unlikely to make any final recommendations until this fall. So given that timeline, is that enough time for state officials like yourself to actually digest the information that they're getting from the board while still spending this money, more than $200 million, prior to the end of the fiscal year, which is March 31st of 2023?
Yeah, I mean, that's a good question. Clearly we're in the worst overdose epidemic we've ever experienced in this state and in this country. And so we're very mindful of wanting to be able to spend money to expand services so that we can save lives. But at the same time, we need to balance that with the recommendations of the board. So, we've already had 4 meetings with the board. And our hope is to really sort of move things along so that we can receive their recommendations, so that we can spend the money, in a timely way. We really don't want to wait, but yet, at the same time, we want to make sure that we get the recommendations from them.
I believe under statute, a recommendation is due to the legislature, I think in November. So that would give you, 4 or 5 months to actually spend the money. Is that timeline doable, or would you like to see an accelerated process from the board?
Yeah, I mean, we're asking ourselves the same question, and you're absolutely right that a report is due on November 1st to the legislature and to the executive branch. I think that this is new. The board, and so I think we're still sort of all finding our way in terms of making sure that the board is making thoughtful recommendations. So it is a balance. I think there's a sense of urgency, but there's also a sense to make sure that we're not that we're being thoughtful about how the money is being used, and so that the money can be impactful and really saving lives. So like I said, we've had 4 meetings just in the last 2 months, right. Which is a lot, and we have additional meetings that are planned for the coming months, and so we will see. But we certainly feel an urgency because we know that people are dying at the highest rates we've ever seen, and we want to do everything we can to save lives.
Well, you've talked about in previous interviews your desire to listen to the board and really consider their input. In practice, though, what will that actually look like? Is there going to be some sort of formalized process for reviewing whatever the board produces? Or, as some cynical people might think, is this more about giving them a pat on the head and sending them on their way and then doing whatever you want?
So I think, the board is really working on a rubric and a framework in order to really guide their recommendations. And that's really what they've spent a lot of time in the last few meetings discussing. Ultimately, the recommendations go to the legislature and the executive branch. And then from that, decisions are made. So, I think it's certainly a process that they're working on their end right now. And then we'll see what we get. But those recommendations do go to the legislature and the executive branch.
If the board ends up recommending that even a tiny fraction of settlement money is for, say, more controversial purposes like harm reduction policies such as overdose prevention centers, where people with substance abuse problems can basically consume illegal drugs legally. Is there a sense that the Hochul administration would actually consider those policies and implement them, or is that kind of idea dead on arrival?
So the Governor Hochul has not, taken a stance on overdose prevention centers. And we at the New York State Office of Addiction Services and Supports, we don't fund and we don't regulate overdose prevention centers. However, harm reduction is a very much a strategy that is embraced by myself and by the governor. Harm reduction includes really a range of services and an approach. So those kinds of services that harm reduction would include is an expansion of naloxone, right? So that's what we give people when they're overdosing, and that saves lives. It also includes meeting people where they are, literally and figuratively. So if people are not ready for treatment, there's still services that can be provided that can reduce the risk of overdose. This is fentanyl test strips is one of the other, key harm reduction strategies that we're trying to really expand as well. Doing outreach, so meeting people on the streets, giving them the education and the materials that they need, linking them into treatment, and providing treatment in a way that really is easy and accessible. And so, instead of waiting 2 weeks for an appointment, being able to get services on demand at the moment that somebody's ready for treatment. So those are the kinds of things that really are, use a harm reduction principles and a harm reduction approach. And we are actually doing those things now at OASAS. And so one example is we've had an initiative where we're bringing mobile medication units out to communities that don't have methadone treatment available. So we're bringing the treatment to where people are, trying to reduce barriers and make it easier for people to access life-saving treatment. So absolutely embracing harm reduction, especially as we are at the worst overdose epidemic ever. We really need to focus on saving lives, and harm reduction focuses on that. It's reducing harms in many ways and really making it easy and accessible for people to access services.
Have you, in a personal capacity or as a commissioner of OASAS, had a chance to visit the two operating overdose prevention centers in New York City? And if so, what's your thoughts about them?
So prior to becoming the commissioner here at OASAS, I worked in the New York City Department of Health and Mental Hygiene. And so it was during that time when I was there in which the overdose prevention centers opened. So I did work with the city and other city agencies during that time. I also have to say, David, I'm a physician, and I've worked in the field of addiction for over 20 years. I worked in the South Bronx, which has been experiencing an opioid epidemic for decades. And I saw firsthand how difficult it was for people to get treatment 20 years ago, 15 years ago. So I developed programs working very closely with harm reduction organizations in New York City to really provide services in a way that people would feel acceptable. And so I personally did outreach in the Bronx and in Harlem, on street corners, in hotels that are single room occupancy hotels where people who were homeless, had temporary emergency shelter, to really bring services to where people are and to meet those who are at the highest risk and the most marginalized. And so for decades, I have been really practicing harm reduction and working with harm reduction organizations to be able to get services to the most marginalized people. And certainly now as a commissioner, my role in government is to make sure that those who are most marginalized and at highest risk have services. And so, for me, it's a little bit of a no-brainer to embrace harm reduction here. I think that it's now being embraced more across the country. For some it's new, but for others, it's really been what's been happening for decades. So it's about bringing people along so that we can really focus on saving lives And we know that harm reduction approaches are evidence-based. There's decades of research that shows that harm reduction approaches work, saves lives, reduces complications, and improves community outcomes as well.
Well, we've been speaking with Dr. Chinazo Cunningham. She is the Commissioner for the State Office of Addiction Services and Supports. Dr. Cunningham, as always, thank you so much for making the time, and go Washington Huskies.
Thank you, David.